Okay, welcome to Deep Dive 2. This is for nutrition and cholestatic liver disease. Correct?
Which one do you want to be in? Oh, God. That was good. Hi, everybody. I'm Kathy Looms from Children's Hospital Philadelphia.
Hi everyone, I'm Shami. I think you heard from me and where I've come from. But I'm an adult ALGS warrior, and I'm on the board of the ALGSA. So yeah, that's me.
Great. Go ahead.
You have one.
And I'm Cher Bork, and I'm the Executive Director of the Alagille Syndrome Alliance. And just want to welcome all of you to our session today. Thanks.
I think these are meant to be relatively informal, so we don't have slides or anything, and we thought we would I guess we'll just take questions.
Yeah.
I mean, is that the best way? Like, do people have certain things that they want to discuss or bring up, particular topics? Yeah?
Well, let me give her
Sure.
Hi, Kathleen. I'm looking for advice on how to deal with my son in terms of interest in him in eating the food that's best for him, making the right choices.
Really far away. What am I doing up there? I'll sit over here. So how old is your son? 10 years old. And
And now he's having lots of proteinuria and chronic kidney disease. He's developed that. So nutrition there's very little doctors can do with medicines now, but there's a lot he could do to himself if he ate the proper food, if he avoided sodium and at least. But it's not easy.
yeah, I think the restricted diet from the kidney doctors is kind of one of the most difficult, I think, to deal with. A lot of times they want to restrict the amount of protein, and they want to restrict phosphorus and potassium and sodium and all of those things. And a lot of the foods that kids like to eat are kind of high in all of those things. So, where do you live?
In Madrid, in Spain.
Oh, in Spain. And are you able to work with the dietitian along with the
Yes,
kidney
but
doctor?
He has developed he says he hates nutritionists. Oh, mommy, these people study for 7 years just to make us children not eat what we want. I don't like them. So I don't want to see them. He's like, he wouldn't be interested in asking questions and stuff. I just got him to speak with Dr. Henry, and Dr. Henry could explain to him what sodium does to the blood vessels, and I think he got it, but he was saying, but I don't put salt into my food, and it's true, he doesn't actually put salt, so he doesn't see where the sodium is coming from.
Right, but a lot of the snack foods and processed foods and
And the
that, they
cheese.
have...
He's
yeah.
all about macaroni and cheese and pasta
yeah,
and cheese.
Yeah, they have a lot of sodium. Does he like to cook?
Yes, he does. He makes such a mess.
Yeah.
Have a hard time, but yeah, he does.
Yeah, so I think, I was talking to another family here yesterday where they were saying that sometimes actually getting the kids involved in cooking food can be a way to help them get to like to eat the things that they're supposed to eat, because then if they make something, they want to eat it.
And are there any videos available, like cartoons, ways that he could visually see what happens when he eats the things that he shouldn't?
I'm not aware of any, but we could definitely, if we had your email, we could take a look when we get home and see if there's anything that's available, maybe from the kidney side, like if our
Because usually-
dietitian that works with our nephrology team would have any recommendations for resources,
Because
that
that
are
might work.
kid-friendly.
He once
Yeah.
watched a documentary on how sausages are made, and he refuses to eat sausages after.
Okay.
So
That's perfect. Okay. Well, we'll get your email and see if we can find something.
I think.
I have the opposite problem. I have a 37.5-pound 7-year-old who's 3'6". She had a diversion and she has a feeding aversion. So she would rather die than eat. And I mean, she would rather play. She would rather, oh, I've had 3 pieces of chicken. I'm done. I'm like, no. Is there anything in their organism? And I also looked to Shami for this question. Does it hurt them to eat? Or is it uncomfortable because of their liver disease for them to eat? And is there something? She's very straightforward. She doesn't eat sweets. She's a very healthy eater, but she doesn't like and those supplements. Oh my God, she's on like Insure Plus, and it takes her an hour and a half to finish 11 ounces of milk because she hates it.
So right now she's on everything by mouth, the
Yes.
regular diet plus some supplements.
Yes,
Yeah.
we're on close to 2,000 calorie diet.
So you're trying to fight this battle every day of getting
Yes.
enough calories into her and getting her
Yes,
gain.
yes,
Yeah. And we do, and she's 7 now.
yes,
And has this been lifelong?
yes.
Issue? Yeah.
Yeah.
I think it's lots of factors that go into it. I mean, we see a lot of kids with Alagille syndrome who eat a lot, even and still don't grow well. So they may drink, 6 cans of Pediatric a day, or, eat everything under the sun. And they
Can I
still
have
don't
those kids'
gain.
appetites
Yeah.
and put it on my kid?
Yeah. And then there are other kids who seem to have some sort of feeding aversion. And we see feeding aversions in pediatric GI a lot of times in children who have reflux, for example, in infancy. Sometimes when little children get reflux and acid coming up, they do have pain, and they associate pain with eating, and then they develop a feeding aversion. Sometimes children who have food allergies develop feeding aversions, things like that. And then it becomes, maybe after a while, there's no actual symptom that goes along with the eating, but it sort of becomes a behavior. And it perpetuates itself. So they just don't turn around and just start eating food, and they're not enjoying eating food. Where you live, is there any access to a feeding program?
I live in Florida. She is in a feeding aversion clinic. We've made a lot of strides.
Yeah.
I should have given you a little backstory. She had a diversion, and after her diversion, she had a paralytic ileus. So she had her stomach suctioned through her nose like 9 times, and then that's when it started. She was on Pediatric exclusively, like for 3 months straight, and then she started eating and not wanting the milk, and she does have things that she likes, but it's so limited. And I try to kind of veer her to understand that if you eat food, you can stop drinking this yucky milk, but it does not seem to filter through her head.
It's a process. I mean, and the kids that we take care of who have these types of feeding aversions, it sometimes takes a very long time with pretty intensive therapy. And at our place, we have also like an intensive day feeding program where kids will get accepted in, and they go actually like every day for a whole month and work with the feeding therapist, work with the behavioral psychologists, and kind of really, a lot of times they can make serious progress in those few weeks, because it's a very intensive time, and just going once a week or once a month or something you don't see as much progress. But sometimes if they get to a point where they're really eating enough, or eating a bit, they can kind of get over the hump and really get into that. And then the other thing to think about would be just other high-calorie supplements that she might like better, like, Carnation Instant Breakfast with added ice cream and things like that, or special smoothies, other things that maybe beside, to kind of mix it up so that she gets a little variety.
Yeah.
Yeah. Please do.
So I can sort of explain how I used to feel when I was being made to eat on a regiment, because you have like your 6 or 8 meals a day, and it's that constant focus of did you eat, and did you put this, and did you put that, and you get tired of the regiment. So part of it becomes a kind of rebellion almost, that you don't want to deal with any more of this kind of strict, regulated, quantity-wise and time-wise. You're just tired of it. You want to be a kid. You want to be free. But the other side of it is I personally have felt discomfort while eating. Like I feel the kind of the pressure that builds up in the stomach. It's not scientific. It's not, I don't even know if it's ALGS related or if all kids have it when they're growing up, when they're, their bodies are trying to figure out how to digest and how to work and things. So I know I did feel discomfort and I hated it. I would fight, and I would fight with everybody, with parents, with doctors, with anybody who came and told me eat food. And my parents would like bribe me, like, if you have half a slice of bread, tomorrow you can watch TV. And it, and then as it got older, it became things like, well, see, if you don't eat now, tomorrow you have this whatever field trip, or you have so-and-so's birthday party, and what's going to happen is you're going to be tired and sleeping in a corner while all your friends are having fun. And then as I got slightly older, it became, well, you want to go participate in dramatics, you want to write plays and act on stage. Now, how are you going to do that if you haven't eaten all of this? So the messaging sort of changed, and my parents sort of stopped focusing on it like, oh, if you don't do this, you're going to die. Like, if you don't do this, you're going to... It wasn't a pressure thing after a certain point. In the beginning, yes, it was, because, new parents and... It's totally completely new. And so as the messaging changed, I started feeling, and I should try something new. And we moved around a lot. We lived in Singapore, we lived in different parts of India, and so it would become this game, like, have you tried this new food? You might like it, like, you just give it a shot. Like it became kind of like a game, and the messaging kind of changed. And so as I grew older, I actually started wanting to try new things. I started wanting to taste healthier options and not just, like, I like salads now. I never used to like salads. I hated vegetables as a kid, and they would try so hard for the vitamins. And so messaging and like not making it so like, oh, you're going to die if you don't do this. And the doctor has said this. And I don't know if fear tactics worked with me, but it was more of messaging and what the food allows you to do beyond this, that you're not just the disease, you're not just the medicines, you're not just the doctors and the diets, but there's so much more to your life, and you can't get to that more without conquering these baby steps. So that's just something I would, yeah.
There's a big control issue too for kids. The one thing she can control is
Yeah.
what she eats.
Yeah.
And then it becomes a battle.
Yeah.
So it's sort of
I'm familiar with the scare tactics. You're gonna get a tube in your stomach if you don't eat.
And that was actually what I was going to talk about. Is my son has a GJ tube, and it was hands down the best medical decision we ever made for him, because we didn't have to focus on all of those things. And I've had people tell me that it was because of lazy parenting that I got the tube, but nobody can convince me otherwise. It is the best thing I've ever done for him, is getting that tube placed and not having to focus, and we don't have those arguments. And he actually eats everything by mouth now. And he was in feeding therapy for 2.5 years, and I remember on his first birthday, my mom put his cake frosting to his lips, and he screamed like you put poison. And I went into the other room and I cried. I was like, if he won't eat cake frosting, how is he ever going to eat green beans? And I don't know why green beans, but that was what it was for me. But he is now like, he was eating tuna salad, and he will eat spicy, like he loves spicy things, very flavorful things. Someone told us that with the liver disease, it dulls your taste buds. He loves spicy, sour, pickle. He is the least pickiest eater I've ever seen, but I've never pushed him to do any of it. If you want to eat it, eat it. If you don't, you'll get it tonight. So I don't know if the permanency of a tube isn't as permanent as you think. It can come out and it grows shut in a couple days, and then it's gone, It's not ideal, but I don't know. For me, I can just tell you in my experience, it was so much better than stressing and crying and obsessing over it, and I've been able to enjoy all the other aspects and worry about all of the other things instead. Yeah.
Yeah. How old was he when he had the tube placed?
So he had his NG placed at 7 weeks, and he had his G placed at 14 weeks, and then he had his GJ conversion. So his stomach didn't process all of his food as quickly as it should. So he was refluxing a lot. So at a year and a half old, he had a GJ. So he has it's like an extra tube inside that goes into the tip of his intestines. So it kind of bypasses his stomach because, like you said, it would cause discomfort. It clearly caused him discomfort to even be tube fed. We did it in very small incremental doses. But once he got his GJ he was 18 months old, he was walking within 2 weeks. So he had a backpack he carried on his back, got up and walked with that backpack. So.
Yeah, certainly a good decision for a lot of families. It's all such an individual decision about what works for each child, but it clearly worked well for him.
I think it just seems like for me, it seemed so scary and so permanent. Like I'm going to have a surgery and surgically put a hole in his stomach to put food in. And just the reassurance that it's not that permanent. When you take it out, we can take it out. He is the J, so it's a little bit different. But with the G tube, you can take it out at home and it's done. And very rarely, I don't want to say very rarely, but not often do you even have to go to the hospital to have a stitch closed. It closes shut by itself and it completely grows. So there really isn't any other thing other than that. I think it's not as permanent and it's not as scary as it sounds.
Shami, do you still have the discomfort now as an adult?
It depends on what I eat and how much I eat. Like if I've eaten a heavy, like say a Christmas brunch, or if you've ever been to an Indian wedding, we eat more than we need to. We eat for a village. So there's a lot. And so if I've ever had one of those sessions where I've had to eat a lot and I've not had a chance to rest it out, I have that discomfort. I also have the reflux even now. There's some days I can feel that it's kind of like a bitter taste, like a kind of gassy bitter taste at the back of your throat where you feel like something is blocking you from breathing even. So I think that contributes to that. So when you're like eating really fast and you're being told eat, it adds to that reflux and that stress on the body. So another thing that I picked up, I remember it was a movie or it was something I watched on TV, and it was about how the French people, they eat really slow. They eat smaller portions and they eat really, really slow. So I am a very slow eater. I can sit on my dinner for 3 hours, even today in the middle. Yeah, because sometimes what I'm eating is too heavy. Because I don't know if you've ever had like Indian food, for example. It is quite heavy. It is quite it's a lot of carbs. It's a lot of spice. It's a lot of oil. So it's a lot of things that my body even today may not be able to process as well as say a normal adult. So I know, and I take my time, and I've told everybody that I eat with, if you're in a hurry, please leave. I have no problem. I will sit here on my own in this restaurant and eat till the cows come home. I don't mind. But I'm not going to put more stress on my body than it already is while trying to digest and process and eat stuff. And I guess when you're a child, you don't know how to articulate these things. You don't know how to tell your parents, if you want me to eat that whole plate, you have to understand I'm not going to do it in half an hour or 15 minutes because I can't. I'm stressed. I'm tired as I'm eating. I'm itchy as I'm eating. Like even now, I don't know if you've seen me eat, like during the meal times and stuff. I'm like scratching on the carpet with my feet, or I'm like doing this in the back. I do that even today because it's like my body telling me, I'm taking care of you now. I'm eating your food, but this is what's gonna happen. It's a part of me. So it's just managing that stress of eating what you need to eat and eating at the right time and eating it at the pace that you can eat. So that's, yeah.
I was just thinking, I don't think that necessarily reflux or slow stomach emptying is really a part of Alagille per se, but I think a lot of times the recommendations that we give to the families and the kids is that you need to eat a lot of calories, and the thing that has the most calories is fat, and then we're giving them, kind of heavy supplements, drinks, avocados, I mean, I think it depends on the person. Sometimes the liver and the spleen are big, and then there's less room. You know, the stomach may get compressed
That's
a little
my
bit
case,
in
yeah.
between big organs, and there's not as much room for you to put as much food in at one time. And also, fatty things tend to slow down the emptying of the stomach. So it may be kind of compounding that we're saying, okay, eat more calories, eat more fat, and then you put all that in the stomach and it just kind of sits there, and they don't necessarily feel like eating again in 2 hours. You know, it might be that things are just kind of a little bit slower to empty out. Maybe smaller, more frequent meals are
Yeah.
better.
Yeah,
in
smaller,
terms of
yeah.
stomach emptying, and also just if the organs are big, there's only so much room in that little belly, and you know the stomach gets a little bit squashed in between the liver and the spleen sometimes. Thank you.
My daughter, she's 10, and she has been stable for a very long time. But I think we're now starting to see some signs of maybe progression. And one of the things we're starting to see is the leg cramps. And they come about once or twice every day, and sometimes they're very severe. So is there anything can be done to minimize it?
Have they checked labs?
They're doing the liver
Like
biopsy.
electrolytes and things like that?
They probably did. I will take a look.
Yeah, sometimes abnormalities in potassium levels can cause leg cramps. So if I have people tell me they're having leg cramps, I tell them to eat bananas that have a lot of potassium.
That's what they tell pregnant women, right?
Yeah, exactly. So you might try that and see if that helps a little bit. I'm not putting it together in my mind why she's having the leg
So
cramps.
it's not necessarily the liver related?
Not necessarily. Yeah.
To kind of go off of that, that's kind of one thing that I've always struggled with. My son's 2. He was in occupational therapy. He wasn't eating, and he was just struggling. But now he just kind of does what he wants to do. We have 3 other kids. 3 other children are extremely picky. And so, you know, the leg cramps, is that Alagille related, or is that just something else? And so I struggle sometimes with, is my son's picky eating related to his Alagille syndrome and we need to address it in that band camp? Or is it just a simple fact that he's a 2-year-old little bugger who just eats what he wants to eat when he wants to eat it? Is there any definitive way to tell any of that?
That's fair. Okay. Hi, partner. I'm partner, everybody. Okay. So, but when he was little, like he had issues with vomiting and everything. And so we were, you know, early on put on some kind of like, for reflux medication that didn't work. So he would vomit like all of his milk. And then, yeah, like food aversions, which, you know, 3 other normal healthy children. I mean, I knew what to do. I was a veteran parent, and it was like you offer baby food and they eat it. And you do, you know, you start with cereal and little bits and they eat it. And with our son, like he was not that way. And then after, you know, months of occupational therapy and little bits that he ate, you know, he tends to like bland foods or super like flavorful foods, you know, spicy foods and things like that. And even now, yeah, we kind of let him do his own thing. We'll put normal food on his plate and he'll eat like a bunch of breads and stuff, you know. So I think that, yeah, part of it sometimes can be like normal 2-year-old stuff, but I wouldn't go as far to say as like he is like normal, because I had 3 other perfectly healthy children, and then, you know, one who was very different. I didn't know what to do, you know. Sorry, guys.
With food aversions, we do have 3 normal kids, but they also all, I mean, we make 4 plates of food for dinner, and they're 4 different plates of, I mean, it's the same food, but it's prepared differently. You know, some eat spaghetti sauce, some hate spaghetti sauce. Some like peanut butter and fluff, some like peanut butter and jelly, some just like peanut butter. And so, you know, I struggle because do we keep trying the same foods over and over again, or is there a cutoff point where we say, okay, well, based off of his Alagille syndrome, we should just not try this food anymore? I mean, is there any difference to anything?
I think in terms of food aversions and behaviors like that, I think, you know, a lot of times it all comes down to their prior experience. And like you were saying, he was a very refluxy baby. He vomited all the time. He probably was uncomfortable. He probably was in pain. And you know, kids do develop some different feeding behaviors sometimes based on that. I don't know if I would say don't try different things. I think with 2-year-olds, you always want to keep offering them, different things, and sometimes they will say no, 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 and then all of a sudden they say yes to the 10th time you ask them if they want to try it. So I would just continue offering him, a lot of different selection of things, and he's going to eat what he's going to eat. And if at a certain point it becomes really an issue for him in terms of growth and not being able to take in enough calories, then you have to think, okay, does he need some supplements, or does he need to see a feeding therapist to think about trying to work with him and get him to accept more foods. Yeah. But I don't think there's anything intrinsic to the syndrome, at least that we know about right now. But there's certainly a lot of factors that come into play with all of these kids, and a lot of them have been pretty sick as babies and maybe have been in the hospital and have had different things happening that have changed the way that they relate to food.
So my daughter, she's G-tube fed and has been taking Peptamen Junior 1.5 for quite some time. And, in my insurance debacle that happened last year, I started to turn to the Facebook groups, and some of the information I received was, hey, if you just want to try this recipe, you can create kind of, I wouldn't say identical recipe to Peptamen Junior, but you can create something that is just as powerful as the Peptamen Junior and do it yourself. How often do you see families that deal with Alagilles that create kind of their own concoction of nutrients, like a smoothie of some sort?
So we're seeing more and more, maybe not just in Alagille syndrome, but lots of the kids we take care of who are tube fed for various reasons. We've seen more and more parents lately kind of gravitating towards blended diets. So we've had a fair amount of experience with that at our center now, and there's some dietitians that are working with the families to create recipes. So I've definitely, I don't know that it's been studied very well yet, but I think I'm hearing from some families that their kids are tolerating it very well, and that that some of them are tolerating it better than formula. I don't want to say it's better than formula, but I think it's certainly a viable alternative. So there's several different ways of going about it. There's definitely some prepared products now that are real food blends, like those types of things that are in packets, and they're controlled amounts of nutrition, and you know exactly what's in it and how many calories and where the nutrients are coming from. And a lot of them are organic, and so some of those products are now becoming available, and we have some families that are using those through G-tubes. I don't know that they can be put through a J, maybe because they're a little bit thicker than typical formula might result in clogging the GJ tube, but a lot of people are using those through G-tubes. And then, of course, there's all your typical formulas, either intact protein like a Pediatric type of thing, or slightly broken down like Peptamen, a little bit easier to digest perhaps, and then with different fat compositions. And then you have the whole blended diet where people are doing stuff at home, usually with like a Vitamix type of setup. The Vitamix blender is very powerful, and it can actually pulverize everything to make it perfectly smooth, so it can be put through a tube. And then I know some families that have, say, like a couple different recipes. They'll have like a breakfast recipe, and then they have a later in the day recipe, and it's basically just food that they're blending together, and they come up with these different concoctions of say like almond milk and blueberries and oatmeal and flaxseed and a number of different ingredients, vegetables and fruits, and sometimes some type of cooked like ground meat or something like that goes into it. And I think some families are very happy with that. It's labor intensive, and it takes a lot of work to actually make these. And the key thing about it is, especially if the child's not eating other food and controlling what they're getting, is that one really needs to work very closely with the dietitian to make sure that the nutrients are balanced. So normally, even picky kids will, from day to day, kind of graze on different things, and they will over time get what they need in terms of protein and fat and vitamins and carbohydrates. But if the intake is completely controlled through a tube, if it's not a formula, I think there really needs to be a lot of input from a dietitian to make sure that what's going in is actually meeting their needs. Mm-hmm. So I think that would definitely be something I would recommend. But it's certainly, I've known a lot of families now who have had actually quite good success with the blended diet, and people have told me that, for example, like if children are constipated, they go on the blended diet, they can stop their Miralax and things like that. So it's certainly a viable option for some people, but it does take a lot of work.
Dr. Looms, we see a lot, we do see recipes a lot on our support groups, especially on social media, and a lot of parents post about MTC oil. Is that a good option for increasing the fat in the diet?
Yeah, so MCT oil stands for medium chain triglycerides, and that's a certain type of fat that doesn't actually need bile for absorption, so it can be absorbed separately, and there's different types of MCT oil available. There's some available at health food stores and things like that. There's also prescription forms available. There's an emulsified form of MCT oil that's available now that works better if you want to mix it into a tube feed, say, like if somebody's getting like continuous feeds overnight through a G tube and you want to mix a little extra oil in there. The emulsified form won't separate out from the formula, which is more water soluble. So that's definitely a way of increasing calories, because the fat has 9 calories per gram as opposed to like carbohydrates or protein, which only has about 4.5. So it's higher in calories and can be tolerated in some patients. Some patients don't tolerate it so well because it kind of doesn't sit well with them. That may make them throw up, but definitely an option. The other thing is DuoCal, which is another additive, like a powder that you can mix into foods. Some people will use that to add calories to things that they're eating. And then also there's like microlipid, but that's long chain fat, so probably wouldn't be absorbed as well in a patient who was cholestatic.
I have a follow-up. So I'm from the southern part of India, and our whole life depends on coconut. We put it everywhere, on our skin, on our hair. We eat it. We do everything with it. So we put a lot of like desiccated coconut and stuff. So is that as good as having the oil, or is it should we just stick to the oil alone? Is that the easier digestible form? What would
I don't know. I haven't had much experience with the desiccated coconut, but I would think it would be good.
Yeah.
I love coconut.
Well, it is yummy for sure, and obviously it's so hot. We keep drinking coconut water as well, so that's a different.
I was just going to ask, could you explain to me what desiccated coconut is?
Okay. So it's like when you break the coconut and there's the white portion inside. So you sort of grate that out, or you like fork it out with a spoon or whatever, and you eat those chunks. They're actually quite yummy. And what we do is we put it we make it even finer. We put it in a blender, kind of blend it out, and put it in all our curries and like sometimes our dal, the lentils that we eat. And that's just from my part of India. And we cook things in coconut oil. That's how things are made at home. Like if you're frying some, vegetables, or you're making some kind of saute, an Indian version of it, we use a lot of coconut oil. So I grew up on that at home anyway. So I was wondering if there's a difference, and is it better to have just the oil, or is it okay for me to like snack on these? Because my parents used to pack, little pieces for me to sort of snack on during the day in school, because I would get really tired and low on energy and sleep in class and not focus and be bratty generally, not take notes in class and not participate. And so this is what I would do. Between every hour, I would just pop a couple of, either little pieces of coconut or biscuits or something to keep me going. So I was wondering if that would be,
And that's what I was curious about.
Yeah.
We have coconut and shredded coconut here, and it's easily accessible. Coconut oil is everywhere. You can buy it in every department of Walmart because we use it, like you said, for everything. Coconut milk we like to cook with. And so I wasn't sure if what I was thinking of is the same, because I've never really heard coconut in any way talk about like desiccated.
Does that part of the coconut have as much fat? Probably not, as just the oil.
That's what I was.
Yeah, it's probably more concentrated in the oil. Yeah, but still, I think pretty high in calories, and it's good nutrition. Yeah, I think next time we should have a cooking demo.
Yeah, we could. Yeah, we could do that actually. Different foods from different
We
parts
need
of
like
the
a
world.
test kitchen, and we could do,
Yeah.
you know, what kind of things can you feed to your cholestatic child? Yeah. Foods that are not good for them. Well, I think in terms of what's good for everybody, I'd say processed foods are probably good to stay away from in general. You know, I mean, not as a, you know, it's certainly something you can eat from time to time, but I wouldn't eat it like every day. So I think, you know, trying to stick with a overall healthy diet, fairly high in fat, like we were saying, increase calories.
In terms of the avoid, we were told early on, like 18 months old, and just casually during one of our appointments, oh, and by the way, don't ever give your liver patients green tea. And I said, oh, I've been putting that through her feeding tube because it seems to help her stomach pain. And he said, well, you know, maybe a cup once a month, not a big deal. I said, I've been putting like 3 cups a day in her feeding tube. And so now I'm just checking, like, was that accurate information? Because it really did seem to help her digestion.
Yeah, I've never told people to avoid that specifically. Okay. Yeah.
Something to look into, for sure. Sandra?
I just wanted to make this comment that I get the feeling every time I speak about nutrition and by listening to other parents that it's very a very personal thing, that it's also very related with psychology. Probably nutritionists should work side by side with psychologists because, as you said, for instance, it's a process getting them to understand and to learn, and we sometimes are just exhausted.
Yeah, I think that's a really good point because, well, for example, like most feeding teams it's a multidisciplinary approach. So there's a pediatrician and a dietitian and a behavioral psychologist as well who's with the team to kind of help the child understand and kind of work past some of the behaviors that they've had. And I think, like we were talking about before, nutrition is such a focus because all people want to see is they want to see this child get up higher on this growth curve, right? You're just fighting every day to get these calories in, and then it kind of becomes a battle with the child, and they don't want to eat all that. You know, they just want to, you know, have a cookie and go play or something. You know, I mean, they want to be a kid. So it's hard, and it does become exhausting for the family, exhausting for the child. It's kind of a battle. It's something the kid can control. Is that I'm not going to eat that right now, and
I just realized that sometimes it's worth just taking a break because because it's one thing what we are trying to teach them, and it's another thing what they learn. Just what she was saying, like her parents were trying to make her eat the proper food, and she felt just the pressure, and so it's not the same what we teach from
it
than
takes
what
the
they learn.
joy out of eating, I think, sometimes.
Yeah, I mean, every time.
Did you go somewhere? Did you wash your hands because you have low immunity and you're constantly under a microscope? Every aspect of your life is.
You as a patient, you mean?
Yeah, me.
Yeah, but as a parent, we feel every time we go for a checkup and they have the blood test results, it's like they're checking us.
Yeah, I know. And so
how well I did this month, how did I feed him properly or not?
No, and like I've heard stories where, you know, in the US, the doctors and like local people around have called child services because they think the parents aren't doing enough for the child, you know, and they think that the child is not getting what it needs on purpose. So, I mean, it's kind of a fine balance, but I think if you keep talking to your child, and it's very exhausting, I'm sure, because we're very annoying. We don't like to listen. We have minds and wills of our own. We're difficult, to say the least. But I feel at some point it kind of starts dawning on us that we're missing out on so many things because we're not eating right, because we're not listening to what we're told. We're being bratty and being terrible to or terrible for or whatever it is, or we've at some point you learn to keep aside whatever's traumatizing you, whatever's making you difficult and feel, you know, traumatized aside in order to also focus on the good things that you need to do, like make the healthy choices. It takes time, but it happens.
I just wanted to tell Sandra, don't focus so much on the doctors. When my daughter was born, my daughter's adopted, and she was born with Alagille. And before our adoption hearing, they asked for her stats. And when they saw how small she was and how small her meals were, although they were very frequent, they said, we're going to take this child away and put her in medical foster care because you're not doing what you're supposed to do. She needs to get bigger. And that puts such a stress on our time and our marriage and our parenting. So we called the doctor and we said, can you talk to these people? So don't look at the doctors as you're being looked under a microscope. Maybe ask for help, maybe reach out and say, you know what, this is what's going on with him. Maybe let's get therapy involved. Maybe let's, what can we do? Because doctors are there to help. And, this is a very grueling battle, so.
Yeah, in time I've even been able, like just last week, to admit when I forget to give him a medicine. Like he went for the checkup and he said, oh, the hemoglobin levels are lower now. And I was like, oh, you know what, doctor, I'm so sorry, but last week I forgot to give him the shot. Oh, I'm so happy you tell me that because I thought the treatment wasn't working. So
It's a marathon.
yeah.
So as a parent of a 13-year-old and a 9-year-old daughter, both of whom are underweight, even though one is not Alagille's, can you guys speak into a little bit, like, I have a concern that, like you say, we're so focused, and we talk about nutrition a lot, and we talk about this, and it's a daily, hourly part of our lives, and I don't want to talk my daughters into an eating disorder. And can y'all provide some, especially with both my girls in ballet, I feel like it is something that I have anxiety, and I'll admit that a lot of my anxiety is unfounded. So I just worry. It's a hobby. But can y'all?
Yeah. Do you want to go first? Go ahead. Well, the way me and my parents sort of worked it out was that it's not about me versus another kid. It's about me alone. So a lot of the times I found that, if you start saying things like, oh, but look how he's growing, and look at your cousin, and oh, so if you do the comparison, that adds a lot of pressure, and I think maybe that I don't know the psychological reasons or the psychology behind an eating disorder, but I can understand that there's stress and there's a kind of pressure there that makes you think I can't deal with food anymore. I'm guessing that's the train of thought. I don't know what it is. A trained psychologist would be able to tell you better. But I do know that with my parents, it was all about me and me reaching my potential and me going far and me going abroad, me being able to act and dance and sing, and it was all about. It was very positive. It was in the beginning because I was diagnosed late, so maybe in the beginning it wasn't so it wasn't so oriented to the positive sides of things. But after that, it really changed. The conversation was, okay, we'll blend down the food for you because I don't like spice. I don't like any harsh tastes. I don't like too sweet or too sour. I like a bit of a balance, and so they changed the way they cooked for me, and they changed the things that they packed in my school lunches, and it became more of a collaborative conversation than what is somebody else doing, why aren't you like them, and why it wasn't like that. And the good thing is my mom, my dad, and my brother and me, we were team Shami, we were team Shambhavi. So for everything, if it was okay, she can't handle this kind of food, it's okay, we'll find some other alternative. We were always, the conversation was how to keep it going and how to keep it all happy. So that's something that I'm very grateful to my mom and dad for, because it starts with your parents, and then we get that attitude as well, and we look and we say, Mommy, this is not working for me. Do you think I can try something else? Do you think I can try a juice instead? Would that be okay? I don't feel like eating an extra roti or another bowl of rice or whatever it is, and can I do this instead, please? And it becomes this kind of trusting and collaborative relationship. So yeah.
Well, and I like too what you said, Shami, earlier, that your parents took it from a negative to really positive in instead of, if you don't do this,
You're
X will
gonna die.
happen,
Yeah.
right? And kind of turned it around to something positive. If you are able to eat this, think about all the energy that you're going to have, or think about what you can accomplish. So you just put a positive spin on it.
Yeah.
I think too. When we have only a couple of minutes left, and I just wanted to quickly shift for a moment. We've talked a lot about the calories. Can you touch on quickly, Dr. Looms, the absorption of the vitamins? Are there some foods that maybe if our kids are only going to eat a little bit, are there some really great foods that help with that absorption? Is that?
Well, I guess in terms of the fat soluble, a lot of kids struggle really absorbing fat soluble vitamins and are on high doses of vitamin D, vitamin K, all of that. We do recommend, if people are on the water soluble form of vitamin E, to kind of mix those vitamins together and actually give them together. That can improve the absorption. And I think also kind of eating them with fat can help a little bit, just because all the fat and the fat soluble vitamins are going to be kind of taken up at the same time. So that's something that could potentially help. But it is a big problem for a lot of children who remain cholestatic, and sometimes we have to go to very high doses of the fat soluble vitamins, especially even the vitamin K. Some kids have to get shots every month of that to keep the clotting numbers normal. And the vitamin D, we sometimes have to really boost up that dose.
For those that missed yesterday, I think it was Dr. Piccoli that really was touching on how high that dose does have to get sometimes with those vitamins. I can't pull out the numbers, but maybe you can.
Yeah, and it's not necessarily that dose is X. It's sort of, let's do this, and then we check a level, and if the level's not high enough, we give more, and we just keep boosting it, and it's really individualized dosing. I think Dr. Kamath mentioned yesterday the DECAS form of the fat-soluble vitamins is available, and there's a form for cholestasis specifically, and those are formulated together, and they have a better balance of the types of vitamins that our kids need. So we use those, and then sometimes even on top of that, we have to add more of certain things, and we're following levels pretty frequently and looking at labs and trying to target everything. And then if things change over time, if the cholestasis starts to improve, the absorption may also improve, and then you don't want the levels to get too high. So it's really a matter of kind of following those levels by the lab work and seeing where things are for each individual.
And can you spell that DECAS for our families? And that's a prescription, right? And they want to ask for, there's two different versions.
DEKAS. Yeah. There's one for cystic fibrosis and one for cholestasis, and they are formed a little differly. You have a picture?
Yes, I have it because she gave it to me yesterday. Okay, you can search for it. Where are your screenshots, baby? Where are the screenshots?
I have no idea.
Okay, let's go to the gallery.
What about downloads?
Here it is. She says it's the DECAS Essential Liquid Vitamins. And I have
Okay.
the whole thing, so.
We'll try to send that out with
Yeah.
our,
Drops.
after the conference, we'll send out everything. We'll include that. If there's nothing else that, we are just about at our time, and I know they're going to start the next one right on time. So thank you so much, Dr. Looms, and thank you for everyone for being in here. Thanks, Shammy.